child will be safe.
Is it difficult to work with children because they have quite a short attention span? They're quite unpredictable. How can you...
Especially with psychotherapy as well.
That's right, yeah.
Indeed. Because, it's really difficult because I'm seeing like hopeless cases who transferred for general anesthesia, full mouth rehabilitations, and severe phobia. That's why they referred for general anesthesia. I canceled their general anesthesia and I see them on chair and I completed the treatment and they just become normal children again, psychologically and dental treatment as well. It's difficult. It needs, you have to have experience and you have to have patience. Sometimes I feel my nurses is, her face getting red. She said, I cannot believe how patient you are to spend all of this time with the children and try, to save them from the risk of general anesthesia.
So obviously, you kind of felt that you needed to kind of address this concern, as you mentioned. How long did the study take?
It took around 4 years.
4 years, yeah. Wow, that's incredibly, it must have been quite a journey for you.
And it was all clinical, so it's all with patient, randomized clinical trials.
And then you decided to open up a clinic in Saudi Arabia. What's the reaction been like there?
The reaction is very positive. Everybody is happy to have this new experience. People start to ask about it. Patients are very happy. Sometimes I have some patients, they already completed the treatment in private hospitals, so they don't need dental treatment, but they phoned me to book appointment for me to treat the phobia for their children.
Oh, wow. Okay.
Like for futures, if they need future treatment or something. Because, general anesthesia will not treat the phobia. The phobia will stay here. So
where do you
and the patient confidence, also the patient confidence, the behavior, everything changed.
Of course. Now, where do you see this going in the future? Do you see yourself opening clinics all around the world?
Actually,
tackling dental phobia one by one.
Actually, this morning I was in contact with the British publishers because I'm starting now to sell my book, and I have also videos. This will explain to the dentist how to deal with children with phobia in details. It's like a guidelines. And I hope really, because I'm international speakers already. I presented my research all over the world in many conferences. But I hope now to start giving this as a course, dental anxiety and behavior management, in university all over the world. Now I'm going to start in King Abdulaziz University in Jeddah. But I told them I don't want to be only in one university, because I would like to extend this new science, because it's a new specialty for the world, for everybody, for all dentists, for all dental students, and
for parents as well. Now, if a parent out there is kind of a little bit concerned, a bit anxious because their child reacts in a negative way going to the dentist, Dr. Al-Namankany, what advice would you give to them?
Just don't be in a rush to go and sign the consent for general anesthesia. Try with your dentist to be more patient and to give more time and attention and to listen to your child. Use the ACDAS scale. Use my scale, because this is the key point for management. It's the key point for management. ACDAS is the key point for management, because it's help you to address the reason why the child is scared and to address the cognition type of the child, if it's positive or negative.
Okay.
So,
Jazakallah khair so much for joining us, and we wish you all the best, inshallah, with your future endeavours. Jazakallah khair.
Thank you very much.
So, Sadia, should we move on to our next feature?
That's right. You know which mammal has really good teeth? Speaking of teeth.
No, go on.
Whales.
Whales?
Yes.
Really? Okay, Sadia, you have to fill me in a bit more then.
Well, speaking of whales, and the very many talents that they have, scientists have come up with some new research which says that whales can imitate humans' voices.
This has been incredible. They've actually...
Have you read
literally,
about this?
I did read about this. In California, I believe that there was research that took place where they actually found that the whale could mimic the sounds a human was making.
That's incredible.
Absolutely incredible. Do you think we could get a whale to say living the life?
Try it.
We can definitely give it a go, can't we?
Try it, yes.
So let's have a look at this in a little bit more detail, and we'll come back to some more discussion in a moment. Sadia, I swear I heard living the life in there. Did you?
Yeah, I swear I heard him say that the scientists have released these audio signs of him mimicking human voice, and that actually did sound so much like a human voice. It sounded like someone was having an argument.
And actually, I think somebody actually when they were diving, they actually thought that it was a human diver under there, and then they realised that it was in fact a whale. Absolutely incredible. Dr. Al-Namankany, what do you think of that? What do you make of that? Whales mimicking human sounds. Incredible stuff.
It's amazing. We can, every day we explore and we discover something new in this life. Really.
Would you be able to psychotherapy the whale into saying something for us?
Maybe in the future.
That's the next project then, inshallah. Jazakallah khair so much.
Thank you very much. Well, unfortunately, we've reached the end of today's show, so a big thanks to all of our guests today, Ruby Ranjan, Iman Bouzabi, and Rahim